First off, yesterday was the first day that you guys were open for the COVID testing here at this facility. How did yesterday go?
It went pretty smooth. I mean, you always have a few kinks. It's a new facility and just getting the staff dialed into all their positions, but it went pretty smooth. We were able to process about 109 patients that were of concern. We ran about 55 COVID-19 tests that are going to be taking anywhere from 4 to 5 days to come back. So that's kind of the Quest that's processing these swabs is getting sent swabs from other labs. So they're really getting backed up. The swabs are taken here, then they're sent to San Juan Capistrano. They're processed, and then we get the results. Other labs became inundated and then transferred their swabs to Quest. So Quest really got inundated. So it's kind of a dynamic process right now as far as how fast the turnaround time for these labs is. It was 1 to 3 days. Now it's 4 to 5 days. A company named Roush is developing a faster test, and Quest is getting ready with the machine to test those swabs. So I'm hoping in the next week we'll have a test that can be done within 24 hours. So I think that's why the truth changes every couple hours. I keep saying that because it's pretty true. As these labs develop more rapid results testing, we'll be able to test more people and get the results quicker. But right now they're telling us 4 to 5 days as of today.
How many people came in yesterday?
Well, the center for COVID saw about 109. We saw about 220, but about 109 were coming through just for COVID testing specifically. We ran 55, and the paperwork is pretty extensive. My staff was all here 6 hours after the patients left till wee hours of the morning processing the paperwork to both the CDC and the Public Health Department. So the paperwork's pretty extensive. It's not digitized yet, so we're doing all manual entry for all the patient data so that the CDC and the Public Health Department can have accurate records for where the COVID is popping up.
Can you just give us some context here? Where are we right now, and what are you guys doing? What kind of testing are you doing?
Yeah, we're at 212 Coffee Road. This is our kind of corporate facility. It has both an urgent care that's 10,000 square feet and a 10,000 square foot COVID testing site. And if you can see behind me, we have we have 2 tents set up. One of them is intake, where we tell patients, we pre-qualify them and see if they meet the criteria for COVID testing. If they do, then they're sent to the second tent over there where it says coronavirus testing. They're processed there. We give them paperwork, and then we send them out to their car. They fill it out, and they bring it back, so we don't have people sort of huddling together and spreading the virus around.
What's the ratio, I'd say? Because I know a lot of people show up to the very first tent. What percentage of them gets sent to the second tent?
I would say probably about 40% right now. I mean, the urgent care side saw probably about 30 or 40 patients more, so probably 40% are going for COVID testing out of the people that come in. And some employers now, we've noticed, are requesting that. They're screening their employees for fever, for cough, shortness of breath, and saying, okay, if you screen, if you're a person of concern from their perspective, they send them here for screening. So then we're working with the employers to make sure they get a negative screen so they can go back to work.
Yeah. So what are the questions that are being asked at tent number 1? What decides whether or not you get sent to tent number 2?
So it's the same 5 criteria we've been mentioning. It's fever, it's cough, it's shortness of breath. Have you been exposed to someone with COVID-19? Have you been traveling to areas where there's a lot of cases? Yesterday we had people from Spain, people from Italy, people from cruise ships. So we had fairly high-risk people that said, hey, I was on a ship that was positive. I just came from Italy where I was in all these areas that they're talking about. I was just in Spain. And they were describing the regions where there's a serious amount of cases. So those are pretty straightforward. You're going to get tested.
Can you just talk to me about the importance of doing something like this in the Kern County community right now?
Yeah, we're just trying to be real organized and thorough with the patients. So when they come in for stuff that may not be COVID related, we still check them out with the urgent care, and the doctor's going to run a thorough exam, check their ears, their throat, their lungs. If we hear anything on the lungs, they're getting a chest x-ray. So we're not doing a sort of drive-by screening test. We're doing detailed medical evaluations and determining who needs antibiotics, who needs testing, and who really needs nothing.
We heard earlier this morning that the first 2 confirmed cases of Kern County residents, we had 2 Kern County residents test positive. That's on top of a 3rd person that is not a Kern County resident that tested positive here. Now that we're getting more tests in the area, are we expecting to see a spike in the number of cases?
Yeah, that's usually how it is. As as Quest gets more efficient at processing these swabs, we should get a lot more positive. So I'm in communication daily with Quest and different labs, figuring out if they've got a more efficient process, but they're telling me they're inundated. I'm calling them with, I took some swabs 4 or 5 days ago and I still don't have the result. And they're saying, please be patient, we're inundated, we're running them as fast as we can. So it's not so much the supply of the swab that's limiting us now, it's the processing of the swab in San Juan Capistrano. That's really the bottleneck in the whole system right now.
We've heard of other places like Ohio where I believe the number is 88 confirmed cases of it there, but health officials there said that they actually believe that the real number is probably about 100,000 people throughout the whole state. What's the likelihood that there are more cases in Kern County here than what's actually confirmed?
Oh, yeah, I don't think anyone would question that. A lot of people will get coronavirus and have a low level. They'll just feel like they have a bit of a cough, a little fever, and they won't get tested. But they are walking through the city and kind of spreading that. So it's kind of like the flu or a cold. If you have a rhinovirus and you go to the store and you're sneezing, you may infect 12 other people. And you don't necessarily seek care and you don't necessarily isolate yourself unless you're feeling really bad. So people will say, oh, I don't feel that bad. Well, you don't have to feel that bad to be very contagious, and COVID is pretty contagious from everything I've read. So that's why they're really recommending, and you see different counties shutting down like Fresno, that are really saying if you don't need to be out and about, you don't need to get your hair cut, you don't need to be, having a big group Bible study, all these things, I mean, they're important, but getting those people together, or having your coffee group, it's not really the time to be getting together. I know even a lot of churches, my church, in fact, canceled their services. It's all online. We're just trying to separate people, let this virus run its course so it has minimal impact.
Just for one positive note, I know we're testing the slow here and everywhere else in the nation, but those 3 positives that we talked about, there's like another 70 something that came back negative. Mm-hmm. So, I mean, obviously the numbers could change as this goes on, but and the ratios could change, but is that a good sign at all that maybe there's not that many people infected here in Kern County?
No, we're getting hundreds of negatives. I just got off the phone with Quest and they're saying we're running hundreds of negative tests. So that's a good thing. I think early on Kern County responded quickly. Some counties took a little more laissez-faire approach and kind of said, we'll deal with it when it gets here. I think we responded pretty quick. And we, at Accelerate, we tried to get out front and tell people, let's just, let's isolate right now so we don't get the disease moving quickly through the county.
What's next? Do you guys keep this open every day from here on out, or what's it going to look like here from now on?
Yeah, our plan is to do this for as long as we need to. If it's a couple weeks or a couple months, we've hired extra staff and we've, ordered extra supplies. Our staff was processing paperwork till, 12:30 last night. So it's long days for us right now. So we want to get through this testing and get it done and not, prolong it any longer than we need to.
You guys open 7 days a week?
We're open 7 days a week. We're open from 8 in the morning till midnight, actually. And the midnight is, our White Lane location is open till midnight. This location for urgent care is open till 9, and the COVID virus testing facility is open till 6. And even though we shut it down at 6, we've got about 6 hours worth of paperwork when we're done. 6 to 7 hours it takes us to process all the paperwork.
I think if I have it straight, obviously this is the testing facility that you guys want people to show up at. What if people are, if they have some of those high risk factors, like they travel to Italy or to New York or whatever it might be, and they show up to another accelerated urgent care facility besides the Coffee Road one, are they able to get tested there as well?
Yeah, I've set up every center with a smaller amount of testing. They have the nasal swab, they have the cups that people can spit into for testing if they don't want the nasal swab. So every center has the capacity, it just has a lower capacity. Whereas we can do hundreds of tests here, the other centers can do maybe 30 or 40. So they have a smaller capacity, but people can definitely get tested if they need to.
we've been trying to spread the word as much as we can about this. A lot of people are curious, what's the pricing?
Quest Labs, from what I understand, is still charging $55. I saw some legislation passing yesterday that says they're going to cover, all the insurance companies pay for it. So if you have Anthem, Cigna, HealthNet, Blue Shield, these are covering it. Kern Family's covering it. But if you have no insurance and you show up and you say, I have these symptoms, and you qualify for COVID, it's Quest charges you $55. We don't charge that. That's what the lab is still charging until the government has decided to pay for it. But I think the good news is most people that show up have insurance and it is covered, so they won't be paying out of pocket for the test.
Is there anything else we didn't ask, or anything else you think is worth mentioning before we wrap?
No, I don't think so. I mean, that was the main thing I thought was important, was that people are going to wait longer than we thought. Yesterday we were telling them 24 to 72. Now we're like, it's going to be 4 to 5 days. One specific lab just transferred all of their testing over to Quest, and they weren't prepared necessarily, so they're getting backed up. So that was kind of the thing I wanted people to know.
Great. Thank you for your time.
All right, thank you guys.